Okay, let's talk about a drug called Terlipressin. This is a powerful one, a treatment that can literally pull patients back from the brink of death. But it's also got a really dark side. And using it without some serious, careful thought can be just as dangerous as the disease it's meant to treat. This is all about a very high-stakes balancing act.
So, you might be asking, why do we even need such a powerful, high-risk drug in the first place? Well, it's because it's used to fight one of the most devastating complications you can find in medicine today.
And that complication is called hepatorenal syndrome, or HRS. Now, the thing you have to understand here is that this isn't a problem with the kidneys themselves. Their structure is fine, they're not damaged. Instead, this is a functional failure. The kidneys just stop working. And it's all because of the absolute circulatory chaos that happens when a person's liver is failing.
And this isn't some rare, obscure condition. We're talking about a massive global health problem. Liver cirrhosis is a top cause of death all around the world, and HRS is one of its most feared complications. It just takes an already terrible situation and makes it catastrophically worse.
For years and years, doctors really had their hands tied when it came to fighting HRS. But now we've got a powerful new tool in the arsenal, something that can genuinely turn the tide. That tool is terlipressin. You can think of it like a synthetic hormone. Its main job is to squeeze or constrict key blood vessels throughout the body. What this does is it basically reroutes traffic. It increases the overall blood pressure, and, this is the most important part, it shunts that critical blood flow back to the kidneys, which have been basically starved. It lets them wake up and start working again. And hey, the proof is in the pudding, right? The data is pretty compelling. In the big landmark confirmed trial, terlipressin almost doubled the rate of kidney failure reversal compared to just a placebo. I mean, for patients who are this sick, that difference is everything. It can be the line between life and death. So this seems pretty simple, doesn't it? We've got a deadly disease and we've got a powerful drug that works. Case closed. But, well, this is where the story gets a whole lot more complicated. This is absolutely not a simple solution you can just use without thinking. And that's because this drug comes with the FDA's most serious type of warning. It's a warning that, honestly, is often overlooked when you're in a rush to treat a critically ill patient. There it is, the FDA's black box warning for terlipressin. Now, for anyone who's not familiar, this is the big one. This is the most serious warning the FDA can put on a medication, and it's reserved for drugs that have potentially life-threatening side effects. The data behind that warning is it's startling. In the very same trial that proved how effective it was, terlipressin more than doubled the risk of life-threatening respiratory failure. So think about that. The very drug that's saving the kidneys could be shutting down the lungs. So does this risk mean we just throw the drug out? No, absolutely not. It just means that clinicians have to be incredibly thoughtful and precise. So the real question is, how do you harness its power while avoiding the danger? We can really break it down into 3 essential steps for using terlipressin safely. And this isn't just, best practice. This is really the only way this drug should be used. First, and this is probably the most common and dangerous mistake people make with this drug, patient selection. It is totally non-negotiable. Terlipressin should never be a Hail Mary pass for patients who are just too far gone, with super advanced kidney or liver failure or really low oxygen levels. Giving it to the wrong patient isn't just a waste of time, it's practically inviting disaster. Okay, second is how you give it. A lot of clinicians just follow the standard playbook, a direct IV push every 6 hours. But that creates these really sharp peaks and valleys in the drug's concentration, which might be what's driving all those side effects. There's more and more evidence that suggests a slow, continuous infusion over 24 hours is much, much safer. This is not a minor detail. It's a critical choice that has a direct impact on the patient's safety. And finally, this is not a set it and forget it kind of medicine. Relentless monitoring is the absolute cornerstone of safety. These patients need to be on a continuous pulse oximeter to watch for any little drop in oxygen. You've got to watch their fluid balance, their kidney function, and any sign of ischemia, like chest pain or belly pain, so you can catch a complication the second it starts. Okay, so let's pull all these different threads together. What's the final takeaway when we're talking about this high-stakes treatment? So here it is, the fundamental conflict of terlipressin. It offers a genuine lifeline to some of the sickest patients we have in the hospital. But its risks are just as profound. The outcome, whether it's good or bad, really hinges entirely on the clinician's ability to navigate those critical considerations, choosing the right patient, the right method, and watching them like a hawk.
And that really just leaves us with this one big thought. Terlipressin isn't just another tool in the toolbox, it's a precision instrument. Its success or its failure, its safety or its danger, it all depends on the clinician's judgment. It's a powerful reminder that in modern medicine, the most important factor is often not the drug itself, but the careful, critical thought that goes into using it.